Nice. Well done, everybody. Next item's a roll call.
Commissioner Hopkinson?
Here.
Commissioner House? Commissioner Leininger?
Here.
Commissioner Collins?
Yep.
Commissioner Facer?
Here.
Commissioner Stoll?
Present.
Thank you.
Okay. We approved the agenda. Everybody's had a chance to check that out.
Move to approve the agenda as presented.
Support. Okay, we have a motion of support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. How about our minutes from the March 27th?
I make a motion to approve the minutes as presented. Support.
Okay, we have a motion of support. Is there any discussion on that? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. All right, we're up to public comment. If there's anybody that would like to address the board, please step over to the podium and give us your name. Takers. All right. We'll move on our agenda here. We have the accreditation presentation. Who do we have joining us?
We have Laura. I'm gonna just murder it, so can you help?
Delaram Bellier.
Thank you. And Sahil, Fadia, and Ashley. All I can get is choker. Joining us today, and then we do have one other member that will be coming later today just to stop in. You will miss her. Her name is Brenda Jagady.
Yes. Good morning, everyone. My name is Laura Delaram Bellier, as Rebecca said. So Brenda Jagady is my Bureau Director for the Bureau of Health and Wellness at the Michigan Department of Health and Human Services. I'm the Director of the Division of Local Health Services. So my office serves as the liaison to all the local health departments in the state to assure that everyone has the resources that they need in order to do the work that they do in your communities every day. We also have a role of assurance under the Public Health Code. And so that's what I'm here to talk about today is local public health accreditation. So I just want to express my appreciation for having me here today and for the partnership that we have with Branch Hillsdale St. Joseph. So we're here to acknowledge the successful completion of Cycle 8 for accreditation. Michigan's local public health accreditation program has been in existence since 1997 to check for compliance with standards across 11 programs. The standards are developed jointly between state and local health departments to ensure programs and personnel are in place to provide efficient and effective services for residents across the state. During Cycle 8, all local health departments maintained their accreditation status for Cycle 7. This cycle has been focused on rebuilding and strengthening Michigan's governmental public health system. There was a one-week review here in April 2023. This included building relationships between state and local program staff, assessing needs for each local health department, providing capacity building assistance, and identifying and developing supports to meet the needs of local health, both individually and collectively. Minimum program requirements for each program area were reviewed and feedback from state staff was provided to the agency. So for example, there are certain things that I just want to call out that really stood out for Branch Hillsdale and their service to your community. So Branch Hillsdale ensures, and St. Joseph ensures services are available to minority ethnic, racial, and faith-based groups in the community. They use Stratus, which is an application that provides medical interpreters to serve the non-English speaking community. Branch Hillsdale St. Joseph Community Health Agency also offers educational materials in Spanish and Arabic. Branch Hillsdale hosts 4 Amish field clinics per year in collaboration with the University of Michigan for the hearing program. An ear, nose, and throat doctor, audiologist, speech pathologist, and geneticist attend the clinics and provide services to children. The Branch Hillsdale St. Joseph Community Health Agency also assists Amish families with transportation through the Children's Special Health Care Services program when appointments are necessary in Ann Arbor. The relationship has been established with the Amish community is a fantastic connection that has had a positive effect on many children and their families. Similarly, Branch Hillsdale St. Joseph is doing an excellent job of providing referral for the children who fail their vision screenings. They have continued to identify as many children as possible during the pandemic years, and kudos to the Vision team for this commitment to children's vision. Finally, I'll just touch a little bit more on the Children's Special Health Care Services programs. Branch Hillsdale St. Joseph Community Health Agency's Children's Special Health Care Services staff have teamed up with Smiles on Wheels to help families with no insurance get dental cleanings at a clinic offered once a month. Another successful partnership has been with University of Michigan Mobile Hearing Clinic, serving clients quarterly. The Children's Special Health Care Services team has done a wonderful work in assisting families with applications for children with special needs. Local families have received modified buggies, wheelchair ramps, stair lifts, and so on, with the help of staff securing bids and helping fill out the required paperwork. So I just want to acknowledge that not only did Branch Hillsdale St. Joseph Community Health Agency complete its accreditation, it also completed what is considered above and beyond. They completed the quality improvement supplement. That's in addition to regular accreditation, in which they demonstrate their commitment to quality improvement through projects, programs, and continuous effort to improve the services and the quality of those services. So I'd like to ask Rebecca to come up to the certificate.
Very good.
So we have a copy of the certificate for every single location and a copy of the quality improvement document for every location as well.
So we can't just have it in one office, right? That's gotta be.
Wow, that would be playing favorites, right?
That's right. Thank you, Laura.
Thank you for your time.
Thank you for being here. Great job, Rebecca. Your team, of course.
It's all
Can you,
these guys.
will you answer any questions at this time? Talking with Rebecca a little bit yesterday, wondering, and she said that this is a 3-year cycle.
Yes.
Why, at the local health level, we're focused on, working with our communities, making sure we're keeping them healthy. Why are we taking staff time every 3 years to go through this accreditation and not push it out to a 5-year cycle?
That's a good question. I don't know why it wouldn't be a 5-year cycle.
I'm sorry, 3 years, every 3 years, we're back doing this accreditation again. And again, to me, we're just taking that staff and individuals out of the field, out of actually working and doing their job to go through this accreditation process. It seems like it can be pushed out, to a wider cycle on that.
I'll take it back for consideration. I would also note that that this is really an opportunity for locals to just do a pulse check. They do try to minimize the amount of time that they're taking staff away from the clinics, and that most of the work is actually shown through their consistent work and reporting that they do every single day. So the state staff programs are, of course, pulling reports of everything that gets submitted through MDSS or MICR or other environmental health programs, so that they show up saying, you've consistently been meeting these requirements, or you've been consistently turning these reports in. So it's reflected back of what has already been demonstrated. So we're not asking anyone to repeat work in order to demonstrate their compliance during the accreditation visit itself.
And during that accreditation visit, is there any auditing that's done? Do you actually pull any files and say, let's look and see what you did here on this
Yes,
situation?
yes,
That was done this last cycle?
yes, there were certain programs that do that. So they sit down, have their own methodologies and some programs where they do a random sampling.
Just sort of, not every program.
Well, for
the
example,
accreditation.
my program, we test for powers and needs, but there aren't 5 because it's just pretty under 3, which is the core powers and duties of the health department, demonstrate how they provide health education, provide nutrition services. So it's more of a collection of materials, resources, website review, and then of course, any like letters for compliance to a restaurant, that sort of thing. So it's not like a chart review like you would see in a hospital, if that makes sense.
I think one of the things that Commissioner Lander and I talked yesterday was that this cycle was focused on education and so there were some programs that didn't have what I would consider the typical review. So, anyway.
Well, I guess in that vein, is there any special reporting that we put together, or is it just we already put together as far as reports go? And they just review it and audit it? I mean, all this sounds exactly
It
like
should
I would
be-
expect to happen, actually.
Yeah, it should be routine work that
Okay.
the staff is doing. A lot of it is quality assurance that they should have on file and record, and it's just available to go.
Yeah,
Go ahead.
and I get to the, you were here and you're here today to present this award for this, accreditation, and you're gonna be back here next year to do the accreditation over again.
Yes.
Yeah, well, hey, don't look at me. We get annual surveys every year. So they're complex, so
Yeah.
I know exactly how it goes. So,
Yeah.
okay. Yeah, as long as there's no special. We got-
I think the only thing that would be considered special because it's separate from the routine things, it's the plan of organization. Comprehensive that it gets submitted with powers and duties, but that's only because that's only required to be submitted on the every 3 year cycle. But it is called for under the public health code, so that provides a mechanism and a schedule for when local health departments have to submit that. That way, it's not a matter of every single time there's a staff change on the org chart, you have to update your entire plan of org. That would be untenable and unreasonable. So we just said it that you only have to submit it every 3 years when you're completing the powers and duties review.
Sure.
And we will be bringing that to you probably at the end of this calendar year. I would stop.
Thank you for being here. We appreciate it.
Thank you so much for having me.
Yeah, skilled nursing surveys, they don't usually give us at the end of it. Okay, moving along here. So we're into the audit presentation. We have Anna?
Yeah, so my name is Dave Porter. I'm a senior manager with Maynard Custodison, and we completed you guys' audit for the year ended September 30, 2024. Wanted to attend today and present the results of the audit, go through the financial highlights with you, answer any questions that I can. And I guess first off, I'd like to thank the office staff here, Teresa, Jennifer, Philip, for all their assistance during the audit. Everything went fairly smooth as it has in the past, so we definitely appreciate that. You should each have received a copy of the financial statements, a letter to the board previously, and then just this morning passed out in a small abbreviated like a presentation pack that I plan to kind of work through as far as my audit presentation goes. So you don't have to flip through the pages in the actual financial statements, although I will refer to certain pages as I go. But everything that I talk about should be in this little presentation packet that was just passed out. So with that, we'll get started with the first page here. The first page of the little presentation packet. A few select paragraphs, excerpts from the independent auditor's report. The independent auditor's report is the one piece of the financial statements that we consider to be our. The rest of the financial statements is yours. We've just given our opinion on it based on the audit. So the audit objective, just like to remind you guys every year that the primary purpose of the audit isn't necessarily to detect or to prevent fraud. That's a management's responsibility. But definitely, if we saw something during the audit that we were concerned with, we would share that with you. But that's not the case this year or in past years. As far as our opinion goes, we've issued a unmodified opinion on the financial statements, so that's the highest level of assurance that we can give. There are four different opinions that are available to us. There's the unmodified opinion, which basically says that everything is fairly presented in accordance with GAAP. If there was a modification from GAAP, there'd be a modified opinion. It would say something like, except for the effect of capital assets, everything is fairly presented, except for the effect of long-term debt or some other missing component. And that would be okay in some circumstances. The third opinion that's available to us would be an adverse opinion. the financial statements are not fairly presented. Or the last opinion that's available to us will be a disclaimer of opinion, basically saying that we couldn't complete the audit and we issue no opinion. So, obviously you don't want to see the, last two opinions, but, the unmodified opinion is what, you as a board want to see, is what management wants to see, the state, that good stuff. So, everything is fairly presented in accordance with GAAP. Next section of the independent audit report lays out the management's responsibility for the financial statements. So management being yourself as a board, administration, all that stuff. You are responsible for the preparation and the fair presentation of financial statements in accordance with GAAP. You're also responsible for the design, the implementation, and the maintenance of the internal controls to ensure that the financial statements are fairly presented. And then you're also responsible for fraud detection, deterrence, and prevention. And then finally, the auditor's responsibility for the financial statements is to obtain reasonable assurance. We can't guarantee absolute assurance. We can give reasonable assurance that the financial statements are fairly presented in all material respects. So we don't test everything, but we test the big numbers, the material amounts, things like that. So with that, we'll go to the first statement, I guess, from the actual financial statements. Statement of net position. This is one of the two government-wide financial statements. So this is going to be more of a long-term, full accrual focus. So it's going to include things that you don't typically see in your month-to-month reporting. It's going to include like your capital assets, any long-term debt that you might have. Looking at the net pension liability, deferred outflows related to pensions, things like that. It's a snapshot of your financial condition on September 30, close of business. A couple things we like to point out here would be your current ratio. So how easily you're able to pay your bills when they come due, your liquidity. So looking at the first simple number there, the $5,573,000 for current assets, as it relates to the $2,245,000 for current liabilities. You're about 2.4 times more current assets than current liabilities. So you're able to pay your bills when they come due. As a benchmark, anything over 1 would be good. Probably 2 is a little bit better to have a cushion. But anything over 1, you're liquid. Next thing I'd like to point out, and it's not circled here, but I always like to look at the net pension liability, just because it is one of the larger amounts on your balance sheet. So the net pension liability itself, probably about 3/4 of the way down the page there, $2,626,975. That's the unfunded portion of MERS as of December 31st, 2023. It's always gonna be 9 months behind for you guys because it's based on MERS fiscal year end. And then that goes along with, there's an offsetting deferred outflows of resources, which relates to the investment earnings, any changes in assumptions, contributions between January 1st and September 30th, things like that. So that $2,676,000 that pension liability is offset by the $1,670,000 deferred outflow related to the pensions. So that results in about $1 million, like a net liability that's going to be reducing your net position for the year. That number was about $1,095,000 back in September 30, 2023. So you improved essentially the net liability there by about $89,000 during the year. And a lot of that is based on investment performance and things like that. So very volatile, it changes from year to year, hard to predict. Last thing here I want to point out would be the positive unrestricted net position there, the $2,214,409. After factoring out the investment capital assets, which obviously you can't spend, you're just going to use those in future years. Next page, the second government-wide financial statement, statement of activities. It's more or less the results of operations. Again, kind of a long-term, full accrual focus. So it's going to include depreciation on most capital assets. When you pay down long-term debt, it doesn't show up here as an expense. It just reduces the balance sheet account. Essentially, we're going to start here on the left-hand side with the various functions of the health department. Then with the expenses in the first column, then the program revenues that support those in the two columns that are right there, the charge for services and then the operating earnings contributions. So The net expense, net revenue column there kind of shows how those programs are self-supported by either charges for services, direct grants for those programs, things like that. Not uncommon to see net losses there. The programs are essentially supported or supplemented by the general revenues down below, which would be your county appropriations, any miscellaneous revenue that aren't specific to a certain program, and then any investment earnings. Which creates the bottom line there, the change in net position, 158,018. So you use a little bit of your net positions in the current year. Next page is going to be the first of the fund level financial statements. So this is probably more of a familiar presentation, the same basis that you see in your monthly reporting. It's going to be, this page here is going to be a snapshot of your condition on 9/30/2024. More of a current resources, modified accrual focus, ignoring things like your long-term items like the capital assets, long-term debt, pension liability, things like that. Thing I'd like to point out here would be your available fund balance, I guess. Non-spendable fund balance would typically be things that are already spent on prepaids, inventories, things like that. So you can't really spend those again. You're just going to use them in the future. The assigned and the unassigned fund balance would be the spendable in future years. Those two items combine to approximately, I guess, 3,462,896. And that relates to your annual expenditures of 8,677,131. It's about 40% of your annual expenditures in fund balance. GFOA likes to recommend at least 17 to 20%, just kind of give yourselves about a 2-month cushion for operating needs. So 40% is healthy, not necessarily excessive. I mean, obviously, big projects can eat up that fund balance pretty quickly, but it's a good healthy fund balance. Next page I want to look at would be the statement of revenues, expenditures, changes in fund balance. This will be the results of operations for the fund on the short-term modified accrual basis. Overall revenues were very consistent with the year before, increased about 0.45%, so less than 1%. A couple of swings that I saw there would be federal and state revenues. Those are down about 375,000 this year compared to 2023. County appropriations, being all the local appropriations from the current and use of like past year's appropriations, that increased about 211,826 from the year before. And then charges for services, the 602,000 in the current year was an increase to about 89,000 from the year before. The expenditures increased for the year by about 8.65%, so not quite 10%. A couple of the biggest changes I saw there would be in the salaries and fringes areas. I believe the salaries and wages increased about 327,000, and fringe benefits increased about 370,000 for the year. And that results in the bottom line there, the net change in fund balance. You used or decreased your fund balance by about 281,750 for the year. The amended budget, as it's presented in the audit, is a use of fund balance by about $500. So you were almost budgeting for a break even for the year, and you ended up using about 281,000. It came to our attention just yesterday that the budget in the financial statements isn't the budget that was approved by the board. It's the budget that was in the financial accounting software. So there's some relatively minor differences there, but we are going to look at how we can replace those pages and get the correct budget in the financial statements for you. So from there, we're going to take a look at the next pages here, a couple of graphs. First one here is a 5-year presentation of your total revenues, total expenditures, and your total fund balance. The blue bars represent your total revenues. Burgundy bars representing the total expenditures, and then the yellow bars representing the total fund balance. So the previous 4 years, 2020 through 2023, the blue exceeded the burgundy, so your revenues exceeded the expenditures. You added to your fund balance. I believe that was the case also in the year before, so in 2019. And then you had that slight use of fund balance here in 2024. So overall, a upward trend in your fund balance over the past 4 or 5 years, and then a slight use in the current year. Next page, shows the composition of your revenues and the, expenditures. Very consistent with the revenues. Biggest swings that I saw here would be, the intergovernmental piece, at 75% in the current year versus 79% in the year before. The light blue there, the appropriations, 12% in the current year versus about 9% the year before. Everything else was pretty consistent. Then for expenditures, some of the swings here. So overall, as a percentage, very consistent. The salaries and wages, 41% in the current year versus about 40% last year. Fringe benefits, 23% this year versus 20% last year. So less than a 3% change. Everything else was within a couple percentages. Contractual looks like that one was 13% in the current year versus about 17% last year. So about 4% swing there, but much smaller piece of the pie there. Next page, because you do spend more than $150,000 annually in federal awards, you do have a single audit every year. It's essentially a compliance audit over the federal programs. I would foresee you having that single audit every year for the foreseeable future. They did just recently increase that. I believe the threshold for next year is going to be $1 million. So not much of an increase. It will still apply to you guys, but the threshold will be going up. Essentially, this is a kind of a summary of the financial and the federal awards audits. So as far as the financial statements go, we issued a unmodified opinion. There were no material weaknesses, no significant deficiencies, and no non-compliance material to the financial statements. As far as the federal awards go, no material weaknesses over the federal programs, no significant deficiencies noted, and no findings required to be reported. And again, we issued a unmodified opinion on your compliance with the federal awards. As far as the federal awards that were tested, we tested the WIC program, so the Special Supplemental Nutrition Program for Women, Infants, and Children. I don't know what percentage that covers of the total federal awards, but because you are a low-risk auditee, meaning that you've had a single audit in the past 2 years with no material weaknesses and no non-compliance or findings over the federal programs, you're considered a low-risk auditee, which basically just means that we have to test 20% of your federal award as opposed to 40% if you were a high-risk auditee. So the WIC program is enough to cover that 20% threshold. And again, no financial statement findings, no federal award findings. I do want to talk about a couple things coming up in the future. So next year, you've got 2 new accounting standards coming up. They're in the notes to the financial statements, I think the last page of the notes, but you've got GASB 101s coming up next year. It affects compensated absences, so kind of a relook at what's considered a compensated absence and what your liability is at the close of the year. So kind of revisiting the estimates of how much sick time gets used, how much vacation time gets used, and any other compensated absences that perhaps weren't considered compensated absences in the past, if they were earned during the current year or in a past year and they carry over to the next year. We'll have to kind of look at those again and see if anything is missing from those. GASB 102 for risk disclosures 2025, so effective next year. Kind of, it'll require you to kind of think about what concentration of risk there is. So if there's a particular vendor that you're heavily reliant on, if there's a particular funding source that you're reliant on, that if one of those things were to go away, what would that do to the health department, kind of a thing. So what is your concentration risk? GASB 103 is coming up in fiscal year 2026, so that's going to affect the reporting model. It'll affect a few minor changes in the MD&A, the presentation of the budget to actual statements. That's probably about it for you guys. So the MD&A and then the budget to actual statements. I believe there's going to be a variance analysis between the original budget and the final budget, as well as between the final budget and the actual results. And then the last thing here coming up would be also in fiscal year 2026. would be GASB 104, which affects the presentation of capital assets. So there's been a few new standards out recently for leases, subpoenas, or subscription-based IT arrangements. So if you have non-tangible capital assets related to leases, those have to be shown separately in the future. Whereas currently they're shown mixed in with the regular capital assets. They'll just be like a separate section of the footnote that deals with just the intangible assets. That's all I plan to go over, but if you guys have any questions, I'd be happy to try to answer them for you. If I can't answer them today, I can get back with you with answers after looking at some work papers.
Yeah, thank you. Good reporting. And I didn't hear you mention it, so maybe you don't track this, but days in account receivables. Are we making sure that we're getting our billing out good, timely?
We don't track
Or
that.
we don't track that at all?
No,
Does our agency?
I don't have anything for you on that.
Yes,
Is that something that I heard you, what's the reporting back to us then?
we don't generally report that back to you. I mean, we can if you would like that in the future.
I mean, in the public sector, that's a different work
Yeah,
piece.
definitely. Ultimately, a lot of the services we provide are they, I mean, are they like fee for service kind of things or?
Yeah, so the biggest, we have several different places where we do fee for service, you know, there's permits in environmental health, and then on the medical billing side, which I think is what
Yeah,
Commissioner Schaefer is talking about, we bill Medicaid for immunizations, we bill for fluoride varnish, we bill for hearing and vision exams for Medicaid, and then we also do some private pay for immunizations. And we are billing for CHW. Something else.
TCM Medicaid is us too.
And that's not included in our report there.
so would you say then that we're getting about 45 to 60 days return from billing, or is it less than that?
Well, we do bill everything within 30 days. We get a lot of rejections here. A lot of rejections. And so sometimes we do have stuff that's out 90 days or more. While we work through the rejections, it's really hard to get answers. Like we've been battling with the CHW revenue billing for 6-8 months now, trying to get that, and there's nothing we can do about it because the Medicaid system wasn't set up for health departments to bid. So we just have to kind of sit on it and wait. But we have other issues that crop.
Yeah, it's a fair question. I mean, I would think maybe in finance, something that.
One thing that Dane said, and I had a conversation with Teresa about this yesterday morning. If you look at page 33 of the actual booklet that you have, and that's what he mentioned there, that the budget numbers don't match up with what we actually approved at the Board of Health. And that was, that I discovered that yesterday, and so, talking with Dane a little bit this morning, he's gonna see if we can correct that and send that correction. This has already been sent to the state of Michigan, but we've already submitted our audit, within that 6-month time frame. But wondering about if we can get that corrected in that actual reporting. So,
All right. Other questions? Thanks, Jane. Appreciate you being here. Excellent report. Okay, moving along in our agenda here, we have the health officers.
Good morning. Need more out of here.
before you go, Rebecca, so
Yes.
generally in the past, we do accept the audit. So in trying to see if we can get that corrected, I would just say that I would move to table the acceptance of the audit until our next Board of Health meeting.
Okay, yeah, I mean, I agree. Should wait for them to approve it. Correct information in there. So do we need to table it or do we just want to pick it up next month?
It is later on the agenda under number 10D.
Okay, all right, we'll do it then.
Yeah. So, good. Okay, go ahead, Rebecca.
All right. So I start off talking about the Day of the Capitol and Public Health Week in Michigan, which was, Day of the Capitol was held on April 9th, so the week of April 7th was Public Health Week. And that is the week that I was on vacation, so our agency was represented in Lansing by Chris Dewey and Dr. Lucarello, who did have the opportunity to visit some offices of the senators, right? But our representatives, they met in district, so they were not in session during that week. But it was a great event as usual, and we had a Hometown Health Hero Award nominee that was awarded, the Coldwater Township Sunrise Rotary. And that photo that you see there is Candy Cox off to the right, who works for our agency, happens to be a member of that Rotary. And the gentleman in the middle represents the Rotary, and of course, Dr. So I guess we know who took the picture. So they had a great day, and I appreciate them representing us at Day of the Capitol. I did talk a little bit about the federal grant pullback. On April 1st, we were notified to cease spending on an FY25 grant titled Infection Prevention and Healthcare Associated Infections Response Support, effective March 31st. The grant was funded at $400,000, of which approximately $40,000 had been spent at that point. Although any grant loss is hard to take, we had started planning here for the loss of these revenue sources in the previous fiscal year, knowing that the COVID funding that had been sent to us was likely to end. These grants were intended to allow local health departments to shore up, reestablish, train staff members, because a lot of local health staff were lost during the pandemic. And so we were utilizing these grants to help build us back up. But as I mentioned, we had already started the process of dialing back our spending here. So that's why you see that we only had about $40,000 of this grant spent at the point we were notified. We did have the mobile nursing position that was funded out of this grant, and we pulled that position. You'll remember it had been open. We've been looking for a while to fill it. So that position was pulled and will not be filled now. And we have a temporary part-time person that was also funded out of this grant, and she actually resigned. She's just changing, nothing, just she's moving on. And so we are not going to fill that position as well. So that at this point is how this grant has affected us. Regarding staffing updates, so that means at this time we only have one position that we are recruiting for, and that's the outreach specialist within the Area Agency on Aging. This position is funded out of the No Wrong Door grant that we've been talking about over the past couple of months. As you are aware, there is a measles outbreak in Michigan. An outbreak of measles is 3 or more related cases of measles. So that is in Mid-Michigan District Health Department, but we had a new measles case that was notified yesterday. That case was one as a result of an interaction with another case. So measles, as Dr. Lucarello's report last month, I think it was, explained, is very highly contagious. 9 out of 10 individuals, I believe the statistic was, will develop the disease if they've been exposed and are unvaccinated. So, all right, moving on to respiratory virus season. As you can see from the map there, things are looking better, and that's good news. So we've made it through flu season, and we do not have as much respiratory disease at this time in Michigan. Well, you already know that Laura was here today to present the accreditation certificate, and we thank her and her staff for being here. We do have our date for our next accreditation review. That is March 2nd of 2026. So it's coming up quick. Public health concerns, the blood lead universal testing rules. We are still continuing to wait for JCAR to publish those rules, so nothing new yet. The bird flu or highly pathogenic avian influenza continues to be a concern, with the most recent detection in a backyard poultry flock in Ingham County on March 20th. And then some updates in our buildings in Coldwater. There was a group of bidders here in our office 2 weeks ago to look at the project for repairing the restrooms across the hallway and the restrooms in the main lobby, as well as the clinic counter that's in our clinic area. I do believe that I understood those bids were open and perhaps in process of the county.
Yeah.
The HVAC project is, I think, are they done? I don't
They're
know
quite
if they're done, but they have been here. Today they're not on the roof, but the other day we could hear them on the roof, so. Hillsdale, the contractor that visited our Hillsdale location is continuing to finish the spec sheet so that we can put that, the work that needs to be done over there out to bid. And then in Three Rivers, we did finish the painting project. Thank you very much for supporting that. The building looks great and the staff is very appreciative. We do have a bid for your review today, and that's for new carpet. We are closed tomorrow, and the reason for that is that every year we take a day and we do training with our entire staff. So we close all of our offices, and we will be here in Coldwater at the conference center that's owned by Inside Hospital. And we make a full day of it. So I believe Commissioner Stoll will be joining us
For a very small portion.
for a small portion of the day for awards, and we're glad to have us. So,
Okay.
thank you.
Anything else?
I do not have anything else.
All right, questions for Rebecca?
Rumor control question.
Number control.
The rumor that I heard yesterday was that measles vaccination is recommended for people over 50, even if they have a child with measles. It's not.
No. There is a lot of talk about if we have these pandemics and if
Right.
it becomes a big thing, will we all need to be re-immunized? And, there is some talk.
Maybe that's
Right
what.
now, no, yeah.
Okay,
Yeah,
good.
I have. But it is important to note that, these measles outbreaks, if you look at the statistics, it's upward of mid 90% of those people are not vaccinated. So it's really important for us to reach the unvaccinated people. If we can, I think sometimes no matter what you say and do and how much education you give, you cannot persuade some people with regard to vaccinations, as you know, so.
Good, thank you very much.
Has there been anybody that was vaccinated back in the 60s that has the measles, that has caught the measles in this new outbreak?
There are some immunocompromised,
Okay.
advanced people, but, yeah, immunocompromised.
So if you are immunocompromised, you should probably think about
Have a discussion at least with the provider,
Okay.
but right now the whole re-immunization thing is a no. So,
Okay.
Dr. Brown, we can loop right into your actual presentation if you want.
Hey.
Seem to be heading your way.
Always in business class. So my report is in your packet, and I have to say I always enjoy Capitol Day. It's not only the opportunity to meet people at the Capitol, but just to spend time and I'll give Chris some kudos. It's always very comfortable to go somewhere with Chris and speak to other people about our agency. She's very knowledgeable and well-spoken, and sometimes I can just sit there and let her talk. So, so that's a good thing. And it was fun to take Candy because she had some firsthand knowledge of clients coming into the office. So that was very fun too. So it was enjoyable. And yes, lots of our month has been spent in measles meetings. How do we reach certain communities, you know, again, difficult, right? And they're trying to make a program to reach, say, the Amish patients. And it's difficult. I always say if I feel like I've met one Amish family, I've met one Amish family, right? They're all so different. And so education is the focus of what we're doing. We're just sending out information, meeting with people, and trying our best. And the local providers to get them to understand the system, right? If you think you have a kid with measles, you clearly don't want them sitting in your waiting room. You don't want to send them to the urgent care. So, you know, I wish more people understood that if your kid has a fever and a rash and you're like, oh, what is this? Keep them in the car and call wherever you're going and say, my child is in the car, here's what we're thinking, right? So that we're not doing this exposure. Like that Ingham County, that was exposure into urgent care. So we want to be careful about coming in and obviously not every rash or fever is measles, but right now, if we have some heightened awareness, that's at least very helpful. Let's see, so that was my month. And then, so today I moved on from measles, because we talked about it last month, to some mosquito-borne illnesses. And obviously, when you smash a mosquito on your arm, you don't really think about the fact that there are 200 types of mosquitoes in the continental US, and 12 of them can spread germs to those of us who get bitten by the mosquito. And we have them, obviously, different mosquitoes in the US versus if we travel, so we have to be aware of that. And I'm going to talk a little bit about West Nile virus, which is the most common mosquito-borne illness in the US. But you can look at all the listing. There's Eastern equine encephalitis, there's calf belly, there's Jamestown Canyon, lacrosse encephalitis, St. Louis encephalitis. And we've had dengue and Zika outbreaks in the US. And also this chikungunya, which I practiced several times last night saying, and it still didn't come out. But I actually looked it up because I thought, what an interesting name, right? And it's from the language in Tanzania, and it means which bends up, because if you get some joint pain and arthritis from your mosquito bite, it was named after how the people walked after they got this specific chikungunya, which I probably murdered. And we all know malaria was common in the US as well from the Anopheles mosquito. So we'll talk a little bit about West Nile, and it's obviously spread to people from the bite of an infected mosquito, and that mosquito usually has acquired the West Nile virus from a bird. And the humans are the last host, right? We typically don't pass West Nile on unless it's an organ transplant, maybe a blood transfusion issue, but we're a dead end host. So we can't give it back to the mosquito or pass it on to others of us. So, and we get the typical symptoms of mosquito-borne illnesses. So fever, sometimes rash, just not feeling good, and weakness, muscle pain, joint pain. And the biggest concern is if we get neuroinvasive disease from the West Nile virus and any of these actual mosquito-borne illnesses, the biggest risk is neuroinvasive disease. So less than 2% of people with West Nile will develop neuroinvasive disease like meningitis and encephalitis, myelitis. But when you do, lots of those people end up succumbing to that West Nile. So only 1% will get the neuroinvasive disease, but 10% will pass it. So, and then again, what do we do about these mosquito-borne illnesses? So we have them, right? We have lots of lakes around us. So sometimes I complain about the bats, and my husband reminds me that they're eating the bugs and the mosquitoes. And so are the chickens, and so are all these animals that visit the lake by us. So long sleeves, you know, long pants, and then mosquito repellent or bug repellent with DEET is still the typical recommendation. And then we have our mosquito and tick surveillance program. So we'll have some individuals heading out with traps to kind of see what we have in the area, and that's important for people to know as well. So that's it on mosquito borne illnesses. April is Autism Awareness Month, so I usually just like to throw that out there. I have a niece with she's nonverbal autistic young lady, and so we usually do things for Autism Speaks and just to spread awareness. Right? So I think I might have told this story to the board before, but when my niece was younger, my daughter's a year older than my niece, and we were shopping somewhere, and my niece is nonverbal, but she makes lots of sounds. And so frequently, when you're in a social setting, there's a lot of people staring, right? And you just feel like pass out a form or something that says, just say, stop staring, you know. And if you have a question, ask the question. So we were shopping. I took my niece and my daughter shopping, and my niece was excited because those families also tend to not take those kids a lot of places because of that. So we had her, maybe we were at Kohl's, somewhere, you know, not fancy. And the lady in the waiting room next door said, "Would you please make your child be quiet? I'm here just shopping for clothes." And before I could open my mouth, my 8-year-old daughter said, "This is my cousin, and she's autistic. If you're shopping for relaxation at Kohl's, you should go somewhere else." But I secretly laughed and applauded her, and the lady laughed at her. So again, I always think those of us who know a little bit about autism, we can see it, right? We can see at a restaurant that parents are struggling, or at a store that parents are struggling, and just like a pat on the back, right? You're doing a great job. That's my autism awareness speech. Any questions?
Okay,
Thank you.
thank you. All right, we're up to departmental reports. We'll start with Erie Agency on Aging. Laura?
Good morning. So pretty detailed report, and I did put a hard copy of our Services to Victims of Elder Abuse Grant Project second quarter. They're nearly exceeding by the end of the second quarter now what they did the entire year last year. So some of the outreach efforts I would like to give credit to because people know where to go when they have questions or they do want to talk to a victim specialist about their experience. So our numbers are definitely much higher this year. And we are still seeing number one and number two sort of concerns with individuals are mental health and behavioral health considerations, as well as homelessness. It's really an issue, and there's been a large apartment complex in Sturgis, for example, that I narrated about, is an ongoing and will go into the late summer, early fall, with a purchase process in place. So it further complicates things for those residents who are already financially potentially vulnerable because they have these vouchers that give them much more affordable rent, between $100 and $300 a month. They have these vouchers through the USDA. And so with a purchase, that leaves more than half of the residents very vulnerable to homelessness. And so through some of our team's advocacy and work with the Legal Services Organization, and they did try to set up a more audibly, louder environment in a private conference room for the residents to hear the conference call better. Because as you all know, cell phones are very frustrating sometimes. As you all know, people might not have cell phones. So, and landlines, to sit and listen to an hour-long conversation is very difficult for some people. So our staff were very accommodating, and then we'll be working with other community partners to help support those individuals if and when the time comes that new applications need to be filed and paperwork and other things need to be perhaps discussed with them and gone through in a little bit more detail so that they can hopefully remain in a subsidized housing situation. So I'm really grateful for our friends over in Region 2 who invited us to be a part of another statewide grant called Prevent. It's a statewide, just small line item funding which allowed our VOCA team to participate in this. So it helped offset the staff time. It's been, pretty intensive these last couple of weeks. So it's a great collaboration and a great network to be a part of. So just wanted to share that highlight. We're still awaiting our full year statement of grant award from the Bureau. They are still awaiting as well their notice of award from the federal government. So the dismantling of our federal administration for community living has already reared its sort of head here with no money. We have no federal awards through the rest of the year at this point. So we're hoping they're going to be issued soon. They brought some previously let go staff back in order to physically process and do the work of getting those notices of awards out. But we've already notified, as I again narrated in the report, to our providers that we may have to ask them to hold their grant requests for many of the services that those federal dollars support across our 2 counties. The No Wrong Door project keeps propelling forward. We're still looking, as Rebecca reported earlier, for a full-time options counselor to work across both counties and with our community partners and with individuals and families seeking options for long-term supports and services. The annual implementation plan draft is up and as scheduled on our website. It's still very much in draft format. To this point, to date, I've not received any formal written or verbal feedback. We did share it with the advisory committee last week. Commissioner Schaefer was present for the meeting where I went through each section, gave kind of a brief synopsis of what's going on and what's being outlined in the plan. And really, there's no major substantive differences or changes that we're looking at here. It's a planning document, and it outlines where the funding will go and what services, and then updates our program development objectives and our caregiver services and evidence-based programming. So pretty straightforward document. Nothing earth-shattering to propose for next year. So I did give a little bit of a summary at, again, Commissioner Schaefer's suggestion to just give a little bit of an outline of, what we can expect next. We'd love for any or all of you to attend our public hearing next Monday in our Three Rivers office. That will be held at 10 a.m. So we'll be there with the final draft of the plan. And we'll, of course, report that because there's a whole narrative section that we have to complete in the plan to talk about any input that's given from attendees at that public hearing. So, and then the Finance Committee will review it for the budget purposes. The budget, I will forewarn the Finance Committee, is a new format. It is much simpler, but it is a new format. They've made a lot of tweaks at the Bureau level, which are probably very welcomed by many regions. It's like, I know that the former, like the back of my hand, so it's a little quirky, and we had a version of Excel that didn't jive with the version of Excel it was created in, so there was a little bit of communication sort of urgent over the course of a day or two to get it straight and to get things in the formulas to work on our version. So, but we think it's in good shape now, and it's likely, in the draft right now. So if anybody wants to see it, you can download that on our website. So other than that, I don't know if Ashley might have any updates or anything on federal.
I don't.
Nothing.
I'm always just aware of no news. Really. Laura said everything pretty much. So ACL is the umbrella agency that the State Unit on Aging, which is ACLS Bureau. Sorry, if anybody hasn't met me yet, I'm Ashley Ellsworth with ACLS, State Unit on Aging. But so the State Unit on Aging operates kind of under ACL, and we got notice a few weeks ago that ACL had essentially been dismantled. There are some pieces that still remain, and those that do are going to kind of be dispersed out into other areas. But part of the group that was dismantled are the regional, I don't know what they call them, regional reps, we'll just call them that. And they're the ones that actually send the funding down. So the federal funding goes to ACL, it comes to us, and then goes out to the AAAs. So the individuals that were supposed to receive that funding and then send it down to us, so we could then send it out to the AAAs, or no more, except they've now been brought back to transition. So they're back through June 2nd. I feel very sorry for those individuals being flip-flopped around, but so Scott Wamsley was able to meet with Lacey Bovin, who is our rep, and she is hopeful that it will be coming mid to late May. So what that means for the statement of grant award, we may be operating on a month of state funding until we can, because that's all we can issue at this point, and we can only issue a month at a time. So until we receive that notice, and it is for the full year, so once we receive it, it'll be a nice little, we can all have a sigh of relief for a little while. But it's just getting that grant down.
Now you've gotten through April 30th, right?
Not federal. Federal was only through March 14th, I believe. 31. It was, okay, yep, that's right, we were only able to, okay, yeah, so March, end of March. So right now, April is state. I feel the questions in your head. I know you can. I don't know that I want to poke the bear. What was that?
Are you going to be in Brooklyn this afternoon?
I am. I need to save all the hard questions for that.
Well, because we had finance committee meeting on Tuesday, and we had statement of grant awards through the end of April.
State
For
funding.
state funding.
You have a statement of grant award, it's only state funding. Yeah. And that will have to continue. We can only issue, I don't know why we can't issue longer, but just the way that everything, people way higher that get paid a lot more than me. That we can, I'll just blame it on them. So yeah, that's just kind of where we are until things can get realigned. I did want to mention one other thing. I don't think I mentioned it in this meeting last time. The beautiful name of BP HASA, which is Behavioral Physical Health Aging Services Administration. We can all throw that alphabet soup out the window because it's now just health services, which is a lot easier. I wish it had aging in it, but at least it's shorter. ACLS Bureau, everything under that is the same. Scott Wamsley still reports up to Megan Groen. So nothing changed for us, but if you do start seeing health services, that's the old BP HASA, which is the old, we've had so many name changes, but health services is the new one. I think that's all the major things. If anyone has questions.
So no new letterhead for you.
No new letterhead. No new business cards, thank goodness. I can keep them and not have to scratch it out. Thank you.
Laura, anything you want to ask? Anything else?
I don't. I'm certainly happy to answer any questions. If not, hopefully we'll see you next Monday. Maybe Commissioner Hoffmeister can pop over and say hi. It's time. If I know you're coming, I might have donuts.
Done.
I'll be there.
Excellent. Let's see.
All right, move along. Personal health and disease prevention.
As Becky said, respiratory virus illness is on the decline. Fever is low. I think you asked about the results from the vaccine effectiveness for the seasonal flu. So I did include the interim report, and this is preliminary data, but it does show that the flu vaccine has been effective in preventing diagnosis for children and adolescents that reduced outpatient risk by 36% and hospitalization by 53 to 78%. And for adults, 36 to 54% for visits and 41% for confidence, which is consistent with previous years. I did include the interim estimates for the 24-25 COVID-19 vaccine effectiveness for adults for 18. From September to 24 to January to 25, the vaccine did provide added protection against emergency room visits. This added protection is on top of immunity and previous infections and other vaccinations, which does support the CDC recommendation to get the 24-25 vaccine regardless of COVID-19. A little more on measles here. As of April 17th, 800 confirmed cases were reported over 25 jurisdictions. 96% of those were listed as unvaccinated or unknown. 1% had received one dose of MMR, 2% had received both doses. 11% required hospitalization, and there's been 3 deaths in the U.S. And as of this morning, Michigan has 9 confirmed cases. I just wanted to share a quick update on the WIC caseload numbers. So set September participation and benefit usage have stayed above 4,100, which is an increase compared with fiscal year 2022. This is a nice upward trend, and we are now exceeding our state assigned target of 3,800. I also shared that 4 of our children's special healthcare families have access to TEPRA, the Tax Equity and Fiscal Responsibility Act of 1982, also known as Home Care Children's Program. This is great news for those families. This opens the door to Medicaid for children with disabilities, regardless of their income, so they can get the care and support they need without their families carrying that full financial burden. So it's exciting for our team.
Okay. All right.
Question I got, and you can just email it to me or whatever, on your the chart of infectious diseases there. Animal bite, rabies, potential exposure. Do you track or do we track if those animal bites are from family-owned animals, or if those animals are strays, or
We don't track that. I can find the information out though.
if you would, I'd appreciate it.
Okay, moving along to health education and prevention or promotion, sorry. Chris?
You have my report. Exciting thing just happened. I got yesterday. Hopefully it's going to show up on the TV there for you. So this is part of the Office of Highway Safety Planning Grant. And should be seen at a gas station pump near you.
When you drive in areas with horse-drawn buggies, remember, your vehicle is heavier and more powerful. So when you see a buggy ahead, slow down and don't hold your hand. Your horse. Allow plenty of room because buggies often roll back at stops and pass only when safe and legal. These go slow, which can frustrate a lot of drivers. But if you drive with patience and caution, both kinds of horsepower can share the road safely.
So what Amish community do you get to put the SMD sign on, Chris? I want.
Well, we're working. We actually do have meetings with the bishops coming up here soon to begin having conversations. To begin having some more conversations, and so it's going well. It's a process, right? It's a going process, but it's going well. This month we did have a couple of individuals from the Michigan Department of Transportation join our advisory group. They do have some road projects planned in St. Joseph County next calendar year, I believe it is. And so we're coordinating. Josh will be going out with members from Michigan Department of Transportation to the community to have some conversations around those projects and making sure that those projects are working together to ensure that when they're planning it, that they're including the use and how it will be used and that type of thing. So I thought that was very encouraging that we're going to have conversation before they start laying the asphalt and talking about what makes sense. Lock It Up campaign, hopefully that's going to get rolling here soon. We've got things on order and we're working through the different aspects of that project, so that should be coming. And really, those are the highlights. The community health worker program, she is very, very busy, continues to be very, very busy. Still assisting individuals with finding insurance options, working with homeless individuals or those at risk for homelessness, and trying to assist them with finding financial resources. I did provide a car seat update in the first quarter, the first quarter of this year, January to March. We did distribute 34 car seats, but that quarter is typically slow because you have to be outside and you have to have the kiddo, and the weather is not necessarily conducive to a great opportunity for that. So that is my report, unless you have any questions.
advertise the seatbelt thing, or how do people?
So our car seat program is basically, we do not, it's on the website. We work it with the families that we serve. So families that we serve, we also have partner agencies. So other human service agencies know that we offer that service as well. And so we get referrals from other entities to our program.
Oh,
So these are one-on-one appointments. So this is where we, families identified as having the need. They call us, we try to make an appointment time with them, and then they come in and we work with them one-on-one.
in the state of Michigan, we have changed children, who can ride, where they can ride.
And we've been promoting that information. It's updated on the website. We've been putting it out on social media. We actually are working with a car seat technician program. There's actually one going on next door this week, and they're actually doing car seat check this afternoon. That's a drive-through car seat check. And that we advertised that on our boards up front for the last 6 weeks. So
Right, I think that law just changed here and went into effect with the first of the month here. Have we gone, which, changes the age that they have to be.
we haven't done any specific media around it because the state of Michigan has been doing that information. So
I didn't know if maybe you had gone through those that you helped in the last year or so, that maybe because of the child's age, with the new law, you know, they need a different seat than what we had maybe even provided, to go back and double check though.
So I can suggest to the technician that we might want to take a look at that. And if it's appropriate, we can at least do like a recall to them, but
Right shotgun out of it, yeah.
Yeah.
Can't call it.
Okay. All right. Thanks, Chris. All right. Environmental Health, Joe.
Good morning. Just want to update you, we are hurtling towards the end of food licensing. That's April 30th, and we're getting pretty good compliance. We're getting a lot of things set, so that's helpful for our clerks. We've had 3 kind of new facilities. Car Cafe in downtown Sturgis. It wasn't a new place, it's just a change of ownership that is kind of switched there a little bit. Mocha Town, which is a Middle Eastern coffee place here in town, opened up. And then we issued a limited nonprofit food license to Three Rivers Lions Club to allow them to hold food events to the public. So the other neat thing that I brought prop is D. Anderson has come up with a kit that our SANs will take out on temporary food inspections. So when we go out on a temporary, they have to have certain items or we wouldn't be able to open them. Like they need to have test strips, make sure their sanitizer's correct. They need to have thermometers, got cooking temperatures. Those are things that could prevent a temporary from opening. So we put these kits together. Excuse me. They've got alcohol strips. They've got test strips with the sheet right on it. We have hair nets and beard nets in little baggies. So that way staff and all of our staff are trained for temporary foods. So what you do is you grab this kit before you go out in the field, and if something happens, you're like, oh, we forgot to get the gloves. Awesome. We've got gloves for you. So this isn't for the commercial folks. Those folks know what they're doing. This is for the churches and things like that. They're like, we've never done one, but boy, we really want to get something. And this will really help. We can resupply these at any moment. We've got, I think, 3 in each office. So pretty handy little thing, I thought. The other thing that we did, it's kind of feather in our cap. We had a facility that was found to be using the Teflon baking sheets, and one of our sanitarians in Hillsdale, just through the inspection, asking good questions, found that they were never washing, rinsing, and sanitizing those Teflon sheets. And we brought it to their attention, sent it up to the state, and because our sanitarian asked the right questions and was digging, they're making a corporate-wide, nationwide change to their SOPs because they should be. and they, for some reason, missed it. So that just shows that we're doing good work, I think. So that's on the food side. Well and septics really starting to crank up with the weather being nice. So those are going pretty strong. Kyle is just about the finishing stages of the on-site evaluation for accreditation. So kind of what Laura was talking about, making sure we're doing what we're supposed to be doing to meet those minimum program standards. So we're going to do a pre accreditation evaluation. We're going to sit down and see how we do that. That's coming up next month. So we'll be ready to go when they come visit. Great. That's what I have. And if you have any questions.
The pop-up food trucks,
Yeah.
even the outside people coming in on the weekend, those are inspected through you or the other counties, and how's that?
So those are called TFUs, transitory food units. Those can be licensed in any county, and it's basically a mobile restaurant. They're allowed to go anywhere as long as they provide documentation to us saying that they're going to be within our jurisdiction. So they'll send, Jackson could send us, say, hey, I'm going to be at Walmart, Coldwater, get it set up, and they're able to operate. They may request an inspection from us, a paid inspection, in which we would go out and do that. Some of our own folks do that too.
Like an order.
It is, and there are some cities that are combating that. Sturgis has their own little district where they say you can only operate here. That's starting to happen a lot more. Cities are starting to give out peddlers licenses on top of our license. So yeah, there's been some gripes about brick and mortar saying, hey, I do all this, then they're all bringing it over here. So we do hear that.
Yeah, Sturgis requires a license, I believe.
Yep, they do.
Joe, I just want to say that I appreciate what E and what you guys are doing with that. We talk about all the time about being part of the solution rather than the problem. We want to be seen as, hey, let's partner together to make sure that the safety of the public is kind of our top priority. So that is awesome. And that's a huge example of that. Because there's some things that people are like, hey,
they just don't know.
You just don't know. You don't know what you don't know. If you guys come along and bring that, that's great. It's not like we're trying to get you. It's like, hey, we're trying to help them be successful.
Exactly. We want them to have these events in our communities. That's what makes a community.
Yeah, absolutely. That's great that you guys are doing that.
Yeah, I think that's excellent as well.
All credit to Dee. She came up with the idea and said, hey, can we build this?
Yeah, let's do it. Yeah,
Find a way to issue the permit, to find a way to not issue.
Right.
Correct. Yeah. Allow them to do it safely.
Commissioner House, your Mocha Town there. You sure that? That's your.
I'm
That's
going to go there right after this.
good. Good. You mentioned that in the report.
They said that they
Enjoy that.
import their beans from the Middle East.
Yeah,
So-
where the coffee bean was originally developed, and that's where the mocha down
Yeah, that's what I learned. Because I'm not a coffee guy, so.
there. And this boiled coffee and night liquor. Very good.
Commissioner House is possibly going to become their spokesperson, I think.
Cafe, right next to you.
So
Oh, I'll have to go check it out.
They're all good people that own it.
state troopers. They're state troopers.
Hey,
Dude, it's funny. They're state troopers, and I said, what made you want to do coffee? He's like, thought it'd be a good idea.
Nothing.
Yep.
Another family from that. And then they're looking to open one in Kalamazoo and Fort Meade.
Oh, cool.
Yeah. Two brothers, state troopers.
Good guys.
all right, we're up to financial reports.
Good morning, Commissioners. So you have before you the bills from Art. Couple things I will point out. Page 34, using Butler Body Shop, that was the repair of the mobile unit that we briefly talked about last month, and that will be reimbursed by the insurance company. We pay it out, and the insurance company reimburse us all except the deductibles. And you will also see on page 36 Stratus Video LLC. I point this out because Laura De La Rembellier indicated that we use the Stratus for the language interpretation for different languages, and that is the bill for 1 month of that service. So it is an expensive service, but it's a very, very needed service here. We have a lot of different languages that we can access, and it's not just a telephone; it's a visual. It's an iPad, so they can see the interpreter and enter. So we can even do American Sign Language, which we have done.
And the Aging Network is able to, because of Teresa and her division's collaboration, we're able to offer that to providers as well. So if they have customers, the ASL has been our most recent example, consistently used for that in the fall, to look at drug plans and to make sure they sign up for the right one, and they need American Sign Language. So it's an amazing service. Best practice for sure.
Good.
I'd be happy to answer any questions you have as far as.
Anybody else? Questions, comments?
Move to approve the payment to the presenter.
Support. All right, motion with support to approve payments. Any discussion? Additional discussion, I should say. Hearing none, all those in favor say aye. Aye. Any opposed? All right, motion carries. How about our financials?
Yeah, so on page 37, Commissioner Schaefer, we do list accounts receivable on the balance sheet. It doesn't give the kind of detail you were asking about as the 30, 60, 90, but it is listed on the balance sheet. So it is, the numbers reported, but not in the detail list. Then moving on, we have a few programs that are operating over budget, and we will be working on our budget amendment to address all those concerns. And you should have that probably in hang out till June, depending on politically what we hear and when we hear it. But we are working on the budget amendment now, and we are, as an agency right now, 8.3% under the budget that was approved by the board. Now that's obviously changed because we have had grant pullback. So there's, we're not necessarily 8.3% under the budget as we know it today with that pullback.
Okay.
Move to approve the financial statement for the month end of March 31st as presented.
Support. All right, we have a motion with support. Is there any discussion? I would say receivables don't look bad. Me, I mean, overall budget picture, I guess.
Overall, as far as Medicaid billing, for fee for service type stuff, how much is our total revenue come from that?
I would have to look this up.
But, I'm gonna guess it's a very small dollar figure of the 8 million overall,
It is.
9 million overall budget.
Right, but have 87,000 of that, I was thinking, just too bad, I would say. But it would be interesting to see how we are collecting that.
We do like to see it less. We're having some issues right now with our Medicare billing. So that's a little bit higher than we like to see it right now, but we're working through that.
Okay, other discussion? All right, hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Well, committee reports, finance committee.
I'll defer to Mr. House as I was absent.
Well,
Yeah, and, we, it went over the constitutional bid. And we did make a recommendation to bring it to the full board, kind of contract with.
I think it's on the agenda later.
There's three bids.
All right, well then we're gonna talk about it later. We had a nice meeting the other day. We discussed, Form 5572, which is probably a thing, but I'm just gonna move that we set the finance report. They're on file, I guess.
support. Okay, we have motion of support for the finance committee report. Discussion on that. Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. How about program policies?
Program Policy and Appeals Committee met on April 16th. The minutes of that meeting are in the packet. We did review again the health officer evaluation policy and the questionnaire that we use in that process. So primarily for Commissioner Schaefer and Commissioner Stoll's benefit, Commissioner Collins, if you want to review those questions before we get to the August meeting, or we'll start looking at that and bring that back in September. If you review our packet from this month, they are there. We also looked at the procurement and purchase policy, and we reviewed the annual report that will be on our agenda later, as well as our social media policy. So I would move to approve the minutes from the Program Policy and Appeals Committee as presented.
Okay, we have motion with support. Any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. All right, we're up to new business. And the first item is the aforementioned annual report.
Which you should have this at your place. This is orchestrated out of Health Education and Promotion. They work with all of the directors to obtain the by the numbers sections in here. And it's ready to go. We just are looking for the board to accept it, and then we're going to start distribution.
Move that we accept the annual 2024 report as presented.
Support.
Okay, we have a motion with support. Is there any discussion?
My picture looks okay,
His beard is a little bit short. in
I
this picture.
told them, you know, it's like they gotta get a new picture, and they're like, we don't have one. I'm like, wait a minute, you just took one the other day.
It'll be all set for 2025. I think I made the motion.
Right.
Support, thank
you.
they've been all. I feel left out.
Commissioner House.
You'll get one in.
usually-
I'll get one.
Commissioner House is usually right there.
Catch up. Not done yet.
All right, any other discussion? It's interesting. The one thing we did focus on was the pictures of all things.
Yeah.
Yeah, so. All right, so all those in favor say aye.
Aye.
Opposed? All right, motion carries.
I do have one thing. Steve Lane is out there.
Well, it is, because remember, Commissioner, this is the annual report for 2024.
Okay.
It's just like, you know,
Yep.
if you look at the, right, and
Your one shall be there.
You'll be
Yeah.
there.
Next year.
Oh, Jim.
and when you see the Hillsville County audit for 2024, you'll see his name, not your name, I think, you know.
Okay.
Right, we're looking at that period of time that it was not what we are now.
Exactly.
Got it.
All right, so we're up to the social media policy.
So this is a policy that the board has looked at and reviewed in the past. This just contains some revisions and updates. It does provide the department with direction on how we interact with social media. And we are just looking for you to accept it with the changes as proposed.
I would move to accept the social media policy as amendments as presented.
If you went over and checked the spelling and grammar.
I- A little bit, yes.
If you are moving and accept, I'm gonna. There you go.
Thank you for that long
Time and effort. Yeah, thank you.
Appreciate that.
Simple second, but.
We have,
Had to get in there. Mr. Tom.
Motion to support. Is there any discussion here? We obviously reviewed that at our meeting. And,
Yep.
the hot changes are highlighted there, so it should be pretty easy for everybody. All right, hearing no further discussion, all those in favor say aye.
Aye.
Any opposed? Motion carries. So we're up to procurement and purchasing policies.
And these are really documents that Teresa knows most about. So
Yeah, so there were basically one small change to the procurement policy. The law was changed and the amount available for simple procurement was increased. So we did increase that on that policy. And then we moved the actual purchasing policy and implementing procedure onto the new format that we use for our policies, and added the top section that's in red there on page 65. And this was related to a programmatic audit that we, where they reviewed our policies. And the procurement policy indicated that if you were going to use simple procurement, then the purchasing policy would identify how many quotes needed to be obtained, but that actually was not included in our purchasing policy. So that is why we have added that.
Move to approve the updated procurement and purchasing policy as highlighted. Support.
Okay, we have support. Support. Again, changes are highlighted there. Any discussion? Hearing none, all those in favor say aye.
Aye.
Any opposed? Motion carries. So we are up to audit reports.
I vote to postpone until the May Board of Health meeting.
Support. Okay, we have motion support to postpone that until the May meeting. Discussion. Hearing none, all those in favor say aye.
Aye.
Any opposed? All right, motion carries. Up to Form 5572.
On page
122.
22. My goodness.
Kill some trees.
Yeah, so this is actually it prints really, really small on one piece of paper. So I break it up onto two pieces of paper. It doesn't count. I have to copy and paste it, so that's why it looks a little different than what you would typically see. This is a requirement every year. It's a report on our pension plan and how to do. And I just wanted to highlight that on page 123, on line 6, the funded ratio is 86.4%. That is an increase up from 83.9% in the previous report. So we did get pretty good return on our investment. I'm not sure we can expect to have that trend go forward given the current climate, but right now we're in better shape than we were in the previous year.
Bruce, I have a question for you. So this is from MERS as of the end of this 2024?
Yes.
Okay. We haven't seen that MERS report yet, so you've already gotten these numbers from them through the end of 2024.
This would be from the MERS from the end of 2023.
Okay, 2023.
The new report does not come out until mid-June of the year. We won't have that till June.
Right, so these are the numbers that the auditors used in their audit report, but yeah.
And the auditors actually
Yeah.
know this, for instance.
And we've already, I mean, we really have seen these numbers a year ago when Marnie was here on the MERS data anyways, so.
Yeah, this is just annual reporting, right? Not any more frequent than that.
Yep.
Do we need to approve this?
Yes.
Make a motion, we approve Form 5572 as presented.
Support.
Okay, we have motion of support. Is there any further discussion on that?
Still sort of new, they said that extra. Got it. So. Yeah. Looks pretty good.
Yeah, I agree. That's good to see that percentage. We have a target in mind that we want to get to, but obviously 100%.
Well, and we'll talk about this a little bit more maybe when Marnie gets here. Because we closed the plan.
2015.
Okay. And so we're getting to that point where we're really gonna start seeing our annual contribution increase. I think we're looking at this year was what, 615,000?
Yeah, it was over 600.
And, you know, just our base contribution. And so the question becomes now, when do we stop increasing our actual annual contribution and start drawing down some of that excess contribution that we paid in to help kind of level off and steady our that annual contribution figure that we're gonna have to make, so.
Yeah, I would think.
Actually, we have more people draw.
Oh, for sure.
Yeah, and the number that's reported here is 17, I believe, and we are actually down to 13 people.
For active members, so of
Yes.
the current employees or something like that.
Sure. The exposure improves. All right, any other discussion? All right, hearing none, all those in favor say aye.
Aye.
Opposed? All right, motion carries. Okay, we're up to the Three Rivers carpet replacement.
Yeah, because, we had 3 bids and this is the bid that they think is the best bid. We had it out pretty good. Kevin went over it for trying to. Back the box crumbs off the carpet.
Caught that.
I especially appreciate that this is a local contractor, so
Too.
the
Yeah.
business stays within the county. And so if you have any questions, happy to answer. But it's a good one.
Pretty good finance meeting, so I'm good with this bid and, I think it's good that we're staying with the local. I move that we accept the, bid for Constantine Flooring Center at 33,763.59.
Second. Okay, we have motion support to accept the bid for Constantine Flooring. Any discussion on that? Hearing none, all those in favor say aye.
Aye.
Opposed? Aye, motion carries. Thank you. All right, flip the page if you're looking on your paper agenda. IPHAI grant pullback.
That's the grant I already talked about. Is there any other discussion we want to have about that today?
Are there any other grants that you anticipate that there may be a pullback on?
We are not aware of any more at this time, but who knows?
Yes, that's what I would say too. Jen.
There are other grants with the term COVID in them, like COVID immunizations. So, could there be additional
But
pullbacks?
have we really been using the COVID immunization grant?
Actually, we are using that grant and it helps to support, several of our nursing staff. But, the COVID immunization grant actually was terminated by the federal government, state, and the state has honored our grant agreement and is funding that through some others funding, so
Till when?
till the end of this fiscal year,
Yeah.
which is when that grant is supposed to end.
So yeah, don't anticipate that being in the next year budget.
No.
Okay. All right, so then we're up to Board of Health meeting materials.
So,
We,
do you want?
Did you have the same discussion at, your finance committee meeting or not?
Not really.
So one of the things we talked about the program policy and appeals committee is really as far as our board of health meetings, what do we do? There's Teresa and Rebecca have talked to other health departments around the state, and not all of them even have reports from their department directors at the board of health meeting. So it's a discussion. Been here an hour and 40 minutes so far today. So we continue to have our meetings function as they are. I know here a couple of years ago, we actually changed. We had done the new business and old business and stuff before we got to the director's report, so that, if a commissioner had another meeting or something that, we could actually conduct our business and then hear the reports for the directors. I was the one to ask for that to be changed because, if it's our job as oversight, I feel, of the department. And personally, I guess I like having the reports from the directors so that we can ask those questions and have that oversight role that we have.
I'll just throw in a,
They went to big Southern County. All reports.
Sure.
Yeah, I think we're missing out on that. Our meetings sometimes flip. Really good thing. quick 12-member board, I think we're missing out on a thing. So I would like to keep informed.
Yeah, so when we talked about this in our meeting, our programs meeting, but I felt like, I mean, certainly we understand the value and recognize the value of the information that we receive, but to me, it should flow through our health officer as the oversight for the department. I'm interested to hear what you think about Pine, so too. And so in my experience, typically we wouldn't have like everybody reporting here, you know, the health officer would report, finance would also report, but because that's how that information should flow to the board. Because obviously it's, you know, being a public entity, it's a little bit different than like a private sector thing. It's a private sector, like this would never happen at our board meetings. So, so it is a little unusual in my experience, but again, it's my experience is the private sector. So,
Well, serving on the school board, we had our superintendent report. We also have a report from principal or athletic director as well. So even though they are underneath the superintendent, they, you know,
yeah, I get what you're saying, but we employ a health officer to oversee the department. That's all I would say about that. I gotta tell you, I mean, I don't make any firm commitment either way. I understand, you know, this is a little bit different, but the health officer oversees the departments. The board obviously needs the correct information to take action, but that should flow to the health officer.
We had this discussion at Community Action Agency, which I serve on as a 9-member county board oversight and activities. We do like 2 consent agendas. The first is regular policy procedure, that sort of consent agenda. The other consent agenda portion is the director's reports that are included in the packet. So it allows any of the board of directors people to say, you know, I've reviewed this particular director's report and I have some questions. So I'd kind of like to pull that out and make it a part of the regular meeting for a day. And that's how we, and we do include the directors at board meetings. So if there's questions or input that needs to be had, we can access the director report right there.
Get the answer that you need.
Exactly.
Yeah, that's my experience actually too. All those directors are there, definitely attending the meeting.
Yeah.
But the information is kind of just provided, and if there's reviewed questions, then the questions can be answered there. So,
It's kind of a compromise sort of thing. It does help streamline the overall meeting to about an hour, where before they'd always 2 hours. Just
sure. So obviously we're just throwing this out right now.
Right.
Collect information, say, but super like to cite anything today. You leave as is for now and pick back up, but let's discuss again in so.
It's always been this way since I've been at this table. But
even when you were on the other side of the table as the environmental health officer.
exactly. But I do remember when I was a new sanitarian here, I came to a board of health meeting just because I was curious. And Commissioner Schaefer was on the board at that time, and only the health officer. And I suppose, I don't even know, the secretary to the board, and maybe that was it. We're there to represent the whole department. So I've experienced it both ways here.
Sure.
So, and it was because of conversation from other health officers that, the board had made a request and they were, moving in the direction. Is this, how's it done at your place kind of thing? So we thought we would bring it up here. And,
yeah, that's good.
Yeah. Okay.
I see the value in in hearing the reports. I do, and I appreciate that information. I also would not want to burden the staff. If it becomes like, hey, we're getting in the way of them actually serving the community. They can do both at the same time. I appreciate it. If we feel like there's a burden there, then I certainly understand. Maybe
I'll say open mouth and serve foot. if you're gonna do an accreditation, why don't you do it every 5 years as opposed to every 3, so you're not taking the staff out of the work? Well,
They're sitting here.
if they're sitting here, they're not.
That's right.
Maybe there can be a compromise where we just have 1 month or something, you know?
Yeah, I've seen that done too.
Yeah, Joe, that's my thought.
I guess I look at it, if they're gonna be here, we might just well hear a report from them. If we don't want to hear a report from them, I don't see no sense in them showing up just to sit here to maybe answer a
And-
question that might not ever come.
And to take 2 hours from doing something else, they could be doing it more productive than.
Yeah, I mean, I look at it one way or the other. I mean, either they're here or they're not here.
Whether,
I enjoy having them here because I do get more out of hearing it than reading it. But if we wanted to go the other way, I'm good with that too. I just don't see a point in them showing up,
Right, just to be.
just maybe to have a question.
Rebecca, can you take kind of I mean, it's hard in an open meeting to have those conversations. Can you have those conversations with the directors and just ask if it is up, kind of get that?
That's a good
Yeah.
thought too.
And I guess if somebody did have a question, they wanted the doctor to answer, we could ask that at the thing, and then you could get with her, and then next month it would be the answer.
And I think Dr. Lucarella's contract is maybe different than the other department directors. I believe her contract is directly with the Board of Health as well.
Yeah.
It's not,
Well, I'm just, she's just next to me, so I just want
and again, as far as the other directors.
any of them, you know.
Yeah, right. That's,
Right, I think and the goal of all this would be probably just operational efficiency, right? I mean, how do you make this meeting most
That's right.
efficient for everybody and all that kind of stuff, so.
I mean, I guess there's not a question that's gonna not have to be answered right at that moment or a month. If Rebecca had to take it back. And
There might be times though.
Well,
that- yeah.
well, if there is, then we need them here.
Yeah.
I mean, and we might just well hear from
And I'd just like to point out that we've been here 10 minutes longer than you have, Commissioner House today. So.
I do apologize. Very, very important.
Hey, you got me at finance, so I appreciate it. I'm not
Anybody else, anything else you want to say? You're going to say something?
No, they're the directors, so I'm in their office. Their employees are all just taking too much out of them.
Okay. All right, so we'll move on. Any public comments? Ashley? No.
nah,
You are correct.
She wrote it down.
Thanks, Andrew.
Yeah.
Other Commissioner comments, Commissioner House, let's start with you, since you're a little more French than everybody else.
Yes.
Yeah.
I don't have to.
Oh, good. So that's
Well, I have nothing. I appreciate everybody's efforts. You guys are great job.
any more issues? I forget the town over in for St. Joseph County that had the sewer break. Nope. The last couple of years. That taken care of so far. So far. Yeah. Generally does.
Commissioner House.
Nothing, you want us to leave things here?
You can fix up meeting.
It's up to you. If you are just going to throw it in the garbage, we'll be happy to take them. Yes, we'll be happy to keep them on file here.
All right, so we're up to identifying motion to adjourn.
So moved.
Support.
Okay, with support to adjourn, all those in favor say aye.
Aye.
Opposed. All right. We are adjourned.
Thanks, guys.